Oh well.
Oh well.
That's like my life. We're gonna go see a young man who's been limping. Kind of an interesting story. Hello. Hey. How are you? So tell me the story. What's been going on?
So he's just been having a lot of pain in his leg, and then it seems like in his hip and knee joint. And
Gotcha.
He's been up crying at night.
I'm remembering you were here with the flu a couple weeks ago.
Yep, and then he had hives last week.
Okay, so he had influenza A diagnosed here 2 weeks ago, and then a week ago was here with hives and rash. And then he did have some pains that kind of came and went.
Yeah, he was having some pains in his wrists and his elbow, like when we put his coat on, and then when we get him dressed or change his diaper, and his leg.
In that leg.
Yeah.
Okay, very good. So, let's see. You got a teddy bear on your shirt. Tickle, 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 tickle. And let's see. We're gonna check your arms like last time. Good job. And we check this leg. Move it up and down. Rotate it. Now watch his facial expression, everybody. We're gonna check this one. Move this up and twist. Oh, see that? So I won't do it again. So folks, what we've got going on here is something that has a very long name called toxic synovitis. Oof, that sounds scary. It's not scary. My own youngest son, not the one behind the camera, had this when he was a little older than this and was limping. And what happens with toxic synovitis is that you have a viral infection, and then a week or two, or sometimes a little longer after that, you get this reactive inflammation in a joint. Typically, hip is most common actually in pediatrics. And you can tell that hip is inflamed because when you flex, or especially when you rotate the hip, you just watch facial expressions, and he just, the second time flinched and went into tears, but he was already upset and just leave me alone kind of thing. It is not dangerous. It's not an infection. It's just a reactive thing. We do want to make sure we don't miss a hip infection. I've only had maybe one in my entire career. It's that rare, so I'm not worried about it. If he had a possible hip infection, he'd be sicker looking, he'd have fever, and we would get some blood work just to make sure that we don't have those markers of massive inflammation that could be an infection. In cases where we might have an infection, we have a positive hip exam like that where you're wincing in pain, we usually get an MRI, make sure if there's a ton of fluid, the orthopedists sometimes go in surgically and pull out the fluid to make sure it's not infected. It's a big ordeal. We're not there. This is toxic synovitis. I've seen it 100 times easily, if not more.
Question.
Yes?
How can you tell the difference between what you're describing and trauma to the hip?
Aha. So, that's a very good question, which I should ask you. Has he had any major falls or injuries?
I mean, he's 2 and he runs and falls all the time, so, but nothing major.
Yeah.
Than every day.
Because I had the documented strep infection, not strep, sorry, influenza infection, we have the classic setup for toxic synovitis. The injury, what we call differential diagnosis in pediatrics or in medicine is, okay, this is what it probably is, but what might it also be? And certainly what do you not want to miss? We don't want to miss an infected hip. But you bring up an excellent point. Hate that when the cameraman puts me on the spot and then has a better point than I thought of. No, we absolutely should rule out injury. If there was a story of injury, that would be top of my list, and we'd be doing x-rays of the hips. Okay. Which, if this isn't getting better, we can do. Okay. I think because of the classic story, I'm pretty confident it's toxic synovitis. But that is a very good point. My first normal thought is, was there an injury? We just had the classic story.
And it could be a while till it recoups.
It could be weeks.
Oh, okay.
It could be absolutely weeks. It won't necessarily take that long, but I want you to be prepared for that. Now, what to watch out for if he gets fever or he's starting to look sick, now it's a whole different ballgame. We're going to get some blood work, x-rays, possibly MRI of that hip.
Okay. So if we get that far, we'll come back.
Okay. Thanks, buddy. You get a high five, low five? Yeah, good job. You guys, thanks for watching. This is a limp in a younger child, sort of that preschool age group. And toxic synovitis is by far not the first thing you think of. I just got set up with the fact that I knew he had influenza recently. A limp in a kid, normally you're thinking number 1, injury. Number 2, you know, minor injury that they're milking to get some parental attention. And they always have a normal exam. So I had already walked in here and done the exam and got a wince when I rotated that hip, so I kind of knew what I was dealing with. A small little differential diagnosis for you there on a limping young child. Thanks for watching. I'm Dr. Paul.